Let's get started today. I just want to welcome everyone to our community conversation today and thank Maddie's for the opportunity to be able to share this with you guys every single week. It is a joy to be a part of this team. We've got a really unique guest today. Looking forward to a conversation that I think applies to all of us. And no matter what we do, of course, we're going to talk about with animals, but really in kind of our day-to-day life. And looking forward to a wonderful conversation. So keep your ideas out there. Feel free to ask your questions as we go. And we've got a few announcements we're going to go through before we get started. So let's start with putting your name in the chat and where you're from. And then I'm going to hand it over to my amazing co-host, Christina.
Thank you, Dr. Ray. Yes, please put in where you are calling in from, and I'm putting the question of the day in the chat. Today's question is, have you or a member of your direct team ever suffered from an injury resulting from repeated movements? I guess it doesn't have to be repeated movements. I should say at the workplace. Maybe that's what I should say. So in the shelter or the doctor's or the veterinary office. Would love to hear about your injuries. I currently have a broken ankle. Well, now it's healing, I suppose, which is how I got connected with Dr. Tina Esbenshade, who will be speaking today, who is my physical therapist. But injuries at work, I've definitely tweaked my handling really strong dogs. I've definitely tweaked my wrist and shoulder. Thankfully, nothing too serious. And I know a lot of shelter workers have problems because they kneel a lot, they bend over a lot, lifting heavy objects. How about you, Dr. Ray? Have you ever experienced any work-related injuries?
So many, unfortunately. I think, a lot of times we talk about being up and down all of the time. And I am the kind of doctor that likes to see my patients where they are. So if they're on the floor, I'm on the floor. And making sure that I try to give those animals that comfort. And so that means I'm an adult woman crawling around on the floor. But that's what works for me. But it has really taken a toll on my knees. And I am currently healing from a knee replacement, probably from a lot of that years and years of trauma. And then throughout life, I've experienced, lower back pain, sciatica because of up that bending up and down, up and down. And then one unique thing that happens to some veterinarians, especially those of us that do a lot of surgery, we have this angle where we're looking down and we've got our hands here and not maintaining posture over hours and hours of surgery. This is really common injuries that we get in our cervical vertebrae that can actually cause numbing down our arms. So I've had that from years of surgery. So I'm very familiar with PT and the exceptional, the way that it can make such a world of difference. So love that this is going to be our topic for the day. And
Yeah, I'm seeing some people, Mary Flores wrote, yes, our groomers. I'm sure
oh, imagine.
the scissors and what is this? The shavers. I'm also seeing someone said, oh yeah, I think everyone on the team, Kristen shared, I think everyone on the team has some kind of carpal tunnel or shoulder or knee issue. Um, Definitely a very common. Pat wrote, yes, with the falling accident.
Mhm.
Mm.
Very easy, slippery floors because, we're cleaning or things are spilled or released on the floor. Yeah.
Oh, Mary shared, what an appropriate topic for me. I tweaked my back this morning, tucking in a couch cover of all things. Oh no, Mary, I hope it's okay. Maybe you'll get some tips today from our presentation. Carpal tunnel syndrome. Amanda's recovering from a TTO surgery on my knee. What's TTO?
Probably tell us. Tibial tuberosity.
Tibial
Tubercle.
tubercle osteotomy. Mhm.
Yeah. So that's that front part of the shin bone towards the top, that has a pointy piece that picks out. Some people have it on one on the side from repetitive motion. We see it a lot in
Oof, oof.
some of
And
those things. So that's ouchy, but glad you had that procedure to help.
so please, oof, yeah, please continue sharing your injuries that hopefully you have gotten over from at this point, or are seeking care for. And at this time, I'll pass it over to Amber from Maddie's Fund, who is going to announce our February winners.
Thank you so much, Dr. Taylor and Christina. I am going to go ahead and share my screen. Can everybody see that? The February? Okay, awesome. So we've got our February 2025 prize winners. Next. And first off is the weekly community conversations, one winner of $5,000. And that is Joe Lunsford from K Turnpine Animal Rescue Fund in Lebanon, Kentucky. And we also have our Maddie's Pet Forum monthly giveaway of $3,000. And that is going to Mary Garcia from Spring Branch Rescue in Richmond, Texas. And finally, we have our 30th anniversary $1,000 Cuddly Prize Pack giveaway. And that is going to Elaine Eddington in Genesee County Animal Control in Flint, Michigan. Yes, thank you, all winners. Is anyone on the call from the organizations that have won or any of the winners themselves?
We're here, the K Turpin Animal Rescue Fund.
Hey, Joe, congratulations.
Thank you so much. You just don't even know how happy we are to get this. It's really going to help with our spay, neuter, and all our medical issues and kitten season.
Yes, we all know that's either coming up or you're still in it from last year, right? Some of us now have kittens years, so we're super happy to help and we're very excited for you to be on the call. Thanks so much, Kate Turnpine and Joe, for joining us.
Thank you. Thank you very much.
Anyone else on the call? All right. Well, I am going to stop sharing and congratulations again to all of our winners. To be eligible for these prizes, Elaine, Irene is going to drop the link in the chat so how you can register for next month. And thank you, everyone. Looking forward to the rest of the call and learning more about the important subject of how we can help our bodies so we can do our great work. Thank you, everyone.
Thank you so much for that. Always a pleasure to be able to celebrate that. And don't forget to enter. Make sure you do that every week when you join us. At this time, I want to give space to anyone who's got a national update. Certainly, I'd have you share it in the chat. But if you want to pop on and share it now, that would be wonderful. So does anyone have a national update they want to share?
I have one.
Wonderful.
Hi, I'm Sheila Segerson from Maddie's Fund, and just letting everybody know that this Thursday, March 13th at noon, our Maddie's Insight webcast is going to feature research on shelter staff well-being. Our speakers will be Peter Wolf, who's a research and policy analyst at Best Friends, and Dr. Amanda Weiss, who is a licensed clinical psychologist. And so they're going to share their research findings, but the presentation is going to focus on positive solutions and how shelters can learn from veterinary well-being practices to support our staff and volunteers. So hope to see you all there.
Wonderful. Thank you so much for sharing. Sounds like an amazing content.
Yeah, I'm excited for it.
All right. Anyone else have a national update they want to share? All right, Maya.
Sorry, I'm new to these calls, but would this be a good time to mention the My Dog is My Home conference that's coming up? Yes.
That would be perfect.
Thank you so much. Hi, I'm Maya. I work at My Dog is My Home in marketing and communications. I'm excited to be here today. The My Dog is My Home conference is coming up March 25th through the 27th. It's all virtual online. The focus of the conference is increasing pet inclusive emergency and long-term affordable housing to keep pets with the people who love them. Again, it's virtual and we have a special discount code for our Maddie's friends. And that will give you a discounted rate of $75. That's $65 off of the ticket price. The code is Maddie's Forum. And I can drop that in the chat. Is that good? We hope to see you all there. We already have hundreds of people from nonprofits and government across the country registered. It's going to be a great conference. Thank you so much.
Thank you. Yeah, we'll put that code in the chat. That sounds great. There is a link there. Kristen, did you want to mention your programs that are coming up for community cats?
Sure, absolutely. I feel like I talk a lot, so I didn't want to
Just give me a
interrupt again.
quickie.
All right. We have return to home certification coming up this Wednesday. That's from 2 to 3:30. And that workshop does simple, actionable ways for people to connect lost cats with their owners. It's led by Corinne Burgoyne, who does an amazing job, and her success rate with this has increased. And do not quote me on these numbers, but I want to say it's like 3% to like 26% or something. So it's a really, really good system. So it's worthwhile to learn it. And then we have Trappers Tips and Tricks coming up on Saturday. That's from 2 to 4, and that's advanced training for TNR trappers, and it is so much fun. So I hope you guys will join us.
Wonderful. Thank you so much. Let's get started today. Christine would be so kind as to introduce your physical therapist.
Absolutely. All right, everybody, it is time. Today we have Dr. Tina Esbenshade, who prefers to go by Tina, and she's from Alaska, and she earned her Doctor of Physical Therapy at Baylor University. And after that, she worked travel contracts as a physical therapist in Alaska, Arizona, Virginia, before relocating here to Baltimore, Maryland. And I know there's at least one other person from Maryland listening in from Barks, I think. And she completed an orthopedic physical therapy residency through Johns Hopkins Hospital and George Washington University in August of 2024. And she now owns her own concierge physical therapy business called Monument PT and Wellness, serving the DMV area, DMV as in DC, Maryland, and Virginia. And you can check out her website at monumentptandwellness.com, which I will put in the chat. There we go. And Tina is my physical therapist, and she has been very amazing at helping me recover from my broken ankle. And we're so happy to have you here, Tina. And please, if you guys have questions, please put them in the chat. We'll respond to them if we can during, but most of them we'll put at the Q&A at the end of the session. Tina, take it away.
Perfect. Thank you for that bio. So nice. Okay, I'm going to share my screen and hope that everything works. Okay, can you see my slides?
I'm seeing the presenter view.
Okay. Let me go back.
Looks great.
Do you still see presenter view or do you see the normal view?
Normal.
Okay, perfect. Thank you for having me. I've done a few different presentations like this, but not in this setting, so this is exciting for me. I just want to do a brief little rundown of ways that we can hopefully minimize injury in the workplace, especially for animal care workers, from a PT standpoint. So here are the objectives. I just want to briefly discuss prevalence of workplace injuries in animal care settings, discuss common musculoskeletal injuries in this population, talk about the role of physical therapy in injury prevention and recovery, and then introduce some strategies to hopefully improve ergonomics, postural awareness, and then talk about some modifiable factors which can improve return to work outcomes. Okay, so this is a study by the Bureau of Labor Statistics done in 2016, and it just kind of highlighted, I think, 100 different people and what profession they were in. Vet services was 12%. 100 isn't the biggest sample size, so not like the best study, but just kind of interesting to see statistics on that. And then from workers' comp perspective, how was that split between vets, vet techs, vet assistants, groomers, receptionists, other staff workers? Demands of the profession. This is all something you're familiar with. So things like lifting animals, being in extended periods of bending, twisting, squatting, maybe holding awkward positions, repetitive movements, prolonged standing or sitting in non-ergonomic positions, prolonged kneeling. I Googled a picture of lifting animals and this is what came up, so I had to include it. Common musculoskeletal injuries. So these are the things you think of if you need PT. So any sort of like muscle, tendon strain, sprain, things like that, muscle injury. If you feel like you tweak your back, anything like this is kind of under that umbrella. Sorry, let me move my, okay. These injuries are commonly referred to as repetitive strain injuries, cumulative trauma disorders, or overuse disorders. Because we're talking about work tasks, a lot of this focuses on like upper body, shoulder, elbow, wrist injuries. But there's also things that impact the lower body, knees, hips, spine, all of that. So if we're thinking about back injuries, these are like the strains, sprains from lifting animals, maybe from sitting in a chair for too long, if you're more in that admin role. Prolonged forward bending, maybe we have poor mechanics if we're lifting things. These are all things we'll discuss further down. Shoulder injuries, these could be more of the repetitive overhead movements. So if you're reaching up for something over time, that can not feel great on the shoulders. Dog walking, if you're walking a dog and the dog is pulling and it feels a little uncontrolled, then that could be another thing that injures shoulders, elbows, all of that. Wrist and hand. So like you were saying earlier in the chat, a lot of people suffer from carpal tunnel syndrome, and that could be that repetitive motion. Like I know I was talking to Christina about scooping animal food, and doing that over time can be a little irritating. Or just like repetitive gripping, things like that can impact muscles around the elbow, muscles around the wrist. Neck injuries. This is more for, again, the people that are maybe sitting at a desk for a long time, being in that forward position, like the guy sitting in his chair right here. Not the best position over time. We're using muscles we don't necessarily want to be using. So that's something we'll talk about as well. For knee injuries, prolonged kneeling, if you're getting up and down from the floor repetitively over time, it's not going to feel great on the knees. Leg and foot injuries, so things like plantar fasciitis, if you're standing for a long time, that can be uncomfortable. And then repetitive strain, so things like cleaning, if you're mopping or sweeping, grooming, again, scooping animal food. Those are all things that would kind of fall under what we're going to talk about. What are some risk factors for injury? So things like overexertion, maybe your body is not prepared to do a task that you have to do. So maybe you have to lift something heavy, haven't done it in a while. That could be a cause of injury. Repetitive stress, again, maybe our body's not really prepared to do some of these repetitive movements that we have to do for work. That can also lead to injury. Holding awkward postures for a long time. If ergonomics aren't very good and we have poor lifting techniques, that can be another thing that maybe causes some low back pain or causes some shoulder pain. Lack of proper rest and recovery. So we know with a lot of research, sleep is one of the main like points of time where we do most of our healing. So if you're not getting sleep, that's another thing that can impact all your muscles, impact function, everything like that. So sleep is really important. Stress levels, like in this picture. And then environmental factors. So are the floors slippery? Do we have the right shoes? Is it a safe work environment? Those are all things that can kind of put us at more risk for injury on the job. Role of physical therapy. So there's a few different roles that we would play in this situation. I'm going to be mostly talking about early intervention. So those are things that we can do to help prevent injury right now, prevent injury before they occur, exercise and techniques to treat muscle and strength imbalances. And then next would be more of the rehab and recovery. So say you do get an injury and need to go to a physical therapist. What are things we can do during that time to help you feel better, help with pain, help improve strength, motion, all of that. And then return to work strategies. So this is really important for me as a PT. I think one of the main things I ask when first meeting someone is, what are your goals for physical therapy? What are you hoping to achieve? A lot of the time, depending on if it's a work injury and if it's like a workers' comp setting, then we have to be very specific about, is everything we're doing helping you get back to work, and how does that apply to your specific job needs? But just in general, like if people are out of work for a few weeks, that's going to take a toll on them. So making sure we're on the same page of, is everything we're doing from a physical therapy standpoint going to help you get back to work? So it's kind of fun being specific with some of those movements and yeah, helping speed up that recovery as much as possible. Also, if anyone has questions during this, I can't see the chat on this, so you can interrupt me at any time. Okay, so as far as risk reduction, reducing risk of injury, what are things that are more in our control? So these are all things we'll go through later, but desk modifications, postural awareness. Posture is kind of a hot topic in the PT world, but we're going to chat about it. Exercise, use of proper footwear, lifting mechanics, ergonomics, psychosocial factors, and then break times. Okay, so for ergonomic guidelines, this was taken from the AVMA, and it had a nice little layout of what are things we can keep in mind in the workplace as far as ergonomics go. So a few points to remember: ergonomics can help you in your practice. There are some states that already require employers to implement ergonomic programs. Work-related injuries can happen in jobs with risk factors, but a lot of those risk factors can be reduced. And these injuries, not all injuries can be prevented, but some injuries can be prevented. Reporting symptoms early is important. And then you need to involve all staff members to successfully implement these changes. So very much a team effort. So there's a few things from that guideline that I want to highlight. Not everything was applicable, but we'll talk about some of these. So for things like awkward postures, so maybe you're working with the hands above the head, maybe you're lifting, prolonged lifting, reaching for things, again, scooping animal food, all those positions where your body kind of has to take an awkward position. Those are things that we can kind of brainstorm through and say, what are ways that we can make this more comfortable for you? And more ergonomic. And then if you're sitting at a desk for a long time, like working with your head forward, your neck forward, your back bent, maybe elbows are bent too much, wrists are bent too much. Those are, again, things that we can easily make modifications to help with pain. Squatting or kneeling for long periods, and then, yeah, again, any sustained position for a long time. So working on the computer, in the next few slides, we'll talk about changing height of computer, chair, desk, all of that. Kneeling on the floor, so easy fixes for that. Knee pads, I know they're not the cutest thing, but the animals don't care if you're wearing knee pads or not. Good for longevity of your knees. So wearable knee pads or just kneeling on a pad, those are both great things that you can do. If you're kneeling for a long time and your ankles or your feet are kind of in a bent position, maybe having a pad that covers your entire shin bone so that your feet aren't, like, you're not putting a lot of pressure on your feet. That could be another easy thing to do just to help with kneeling comfort. Standing for a long time or bending forward. We always want to bend from the hips versus the low back. Our hips are a lot stronger than our back, so we want to use good muscles. Again, we're going to go through this a little bit later too. For highly repetitive motions, this is often the carpal tunnel syndrome, wrist injury, elbow injury, the sweeping, cleaning, things like that. For those kind of movements, taking any sort of repetitive movement, taking breaks as you're going is probably the easiest thing. I know we're all busy and we have timelines, we need to get things done, but even just doing like maybe 10 or 15 of the same motion, 5 seconds off, repeat. With mopping, sweeping, cleaning, if we are constantly moving our arms, maybe thinking of ways where we're keeping everything a little closer to our body, kind of forcing you to use trunk muscles is going to be more beneficial than just using your shoulder muscles. For forceful exertions, so this is more when we're lifting up something heavy, maybe our body's not prepared for that, maybe we don't do a lot of exercise, so these motions are new to us. Making sure you have good ergonomics with how you're lifting. If something's too heavy, ask for help. Those are the main things. This is something that is more of the controllable desk modifications. So this was from APTA, which is the American Physical Therapy Association, which is like our main PT board. What are ways that we can improve posture when sitting in a chair for a long time? I know, little sidebar, just in general, low back pain is the main physical therapy body part that we treat, has been for as long as PT has been around. And I know there was like a height of this during COVID when everyone was staying at home because of work, staying at home, working from home, sitting for long periods. So this kind of brought this to our attention of what are ways that we can make working from a computer feel a little more comfortable. Standing desks are great if you have the ability to use one. So for the chair, should have wheels, should be able to twist freely. The chair height should be adjustable, should have adjustable armrests, low back support. I know us as PTs, we love sitting on a stool because they're easy to move, but same thing with that. Adjust it. It takes 2 seconds, make it feel more comfortable. For keyboard monitors, the keyboard should be at the height which allows you to have forearms slightly below horizontal line, elbows bent. Elbow angle is best for determining the height. And then monitor should be directly in front of you, and the top of the monitor should be at eye level. Postural awareness. So this is a little more of a hot topic from a PT standpoint. I will say as a disclaimer, everyone's posture is going to be different. We're all structurally built different. It's not a bad thing. It's just something to keep in mind. So when we're doing any sort of lifting task, really any movement, a lot of that movement starts from our core, from our trunk. So having an ideal posture is going to be helpful for really any movement we do. In this picture, there's a few different postures. The one on the very left is more of that ideal posture that we would love everyone to have. But again, everyone's going to be different. Having a more ideal posture is going to help facilitate better movement patterns. But again, everyone's different. A lot of things that medical doctors love to tell people is, and even like chiropractors, people that come to us, even other PTs, you hear it thrown around that like people are out of alignment. Not necessarily true, most often not the case. Really what I want you to take from this slide is that everyone's posture is different. There's no perfect posture. It's more important to just change positions frequently. So if you're sitting in a chair, even if you're there for 15 minutes, just change positions every 15 minutes. You don't have to stand up and move around at that mark. Just kind of get out of the position that you're normally in, loosen things up, help some of those muscles. If you do work more of a admin role and you are in a desk for most of the day, I would say every hour, stand and walk for like 5 minutes. This can be helpful just to get the blood flowing, again, help kind of use different muscles so you're not constantly using the same ones. And then again, things like changing chair height, table height, all of that is super helpful. Exercise recommendations, because I am a physical therapist. This was taken from the Office of Disease Prevention and Health Promotion. This was a campaign called Move Your Way and talking about how much exercise we should all be getting within a week. So they have different recommendations for adolescents versus adults versus older adults. Key guidelines for adults is at least 150 to 300 minutes a week of moderate intensity aerobic exercise, or 75 to 150 minutes a week of vigorous intensity aerobic exercise. Doing even a little bit of that, if you can't reach that, is still going to be beneficial for your health. Some movement is better than no movement. But again, these are just guidelines based on a lot of research out there. Also important besides just aerobic activity is muscle strengthening. So lifting some weights, doing things like that can be really helpful for longevity and just overall bone health, cardiovascular health. If you don't love exercise, find other movements that you love to do. So it says walk, run, dance, play. It's very specific to kind of make it specific to what you like to do. Footwear, so I had mentioned earlier, things like plantar fasciitis are really common in people who are on their feet all day. So your shoes should be comfortable, should meet the demands of the work environment. So probably slip resistant, maybe waterproof. If able, keep a variety in your shoe type. So if you're wearing the exact same shoes every day for 6 months, your foot is going to adapt to that. And anytime you're not wearing them, it might cause some discomfort because your foot's not used to it. So having variety in the different shoes you're wearing can be really important if you're standing in them at work all day. You should have proper arch support depending on what shoes you're wearing. If you're standing for a long time, footwear with a slight heel lift can help just overall with how you're standing and quote unquote alignment of the body. Lifting mechanics. We're gonna do a little group activity, so be ready. I'm gonna go through the slide and then we'll do it, but yeah, it'll be fun. Okay, so lifting mechanics, this is taken off Physiopedia, which is like a very good PT resource. So if you're lifting, doesn't matter. I mean, if it's heavier, then your lifting mechanics are going to change, but we're not going to get into the weeds of that. But overall, the picture on the man on the left is kind of what we want to go by. So you're bending your knees to lower your body, feet around, shoulder width apart. You want to have a broad base. You want to keep your back straight. You're not necessarily keeping it erect, but more or less straight. If you're picking something up, use a firm palmar grip. You want to keep whatever you're picking up close to your body, because that's, again, going to force you to use trunk muscles, core muscles versus just shoulders. You want everything to be kind of going the same line. So feet are in the direction of the movement, knees are in the direction of the movement. Lift using your legs, not your back. Your legs and your hips are much stronger than your back muscles, so we want to use strong muscles. And then, yeah, if the load is too heavy, wait for help. You don't have to do it on your own. Okay. Because I'm a PT, I'm gonna make you guys move. We have to. If everyone can stand up, I'll do it with you. We're just gonna go through a little lifting motion. Okay, so say you're standing here and you want to pick something up. I want you to have like really poor mechanics. So I want you to just completely bend from your back, keeping your legs straight. Try to touch the ground as if you're picking up something heavy. So I want you to really exaggerate. If you have back pain, you don't have to do this, but really exaggerate, poor mechanics, bending your back. Imagine you're picking something up like 50 pounds and then coming back up to stand. Probably doesn't feel amazing. So something that I like to teach people is a hip hinge where you are using most of your hips. I'll lower this a little. So think about keeping your back nice and straight. You can put hands on your hips. Eyes are going forward. Think about shutting a door with your hips. So hips are going straight back, your back staying nice and straight, bending your knees as if you were going to lift something up. A little more comfortable. That's something you guys can practice. That's your homework over the next week, is if you're lifting up something heavy, maybe you're doing more of that hip hinge pattern versus using your back. Try it out, see how it feels. Okay, another important thing, psychosocial factors. With this, sorry, let me move this. With animal care workers, anyone in that setting, there are particular stressors that can place them at risk for depression, anxiety, higher stress, all of that, just based on the things you're seeing every day. So making sure you are in tune with mental health, all of that is very important. Taking frequent rest breaks. I know this isn't always something you're able to do just based on all the work you have to get done, but it's important to just take little breaks throughout the day. exercise, very important for your mental health. Even going on a 20-minute walk, maybe at lunch or at the end of the day, can be super helpful. Things like meditation, breathing techniques. So I like teaching these to patients who are coming to me with a lot of pain. Being able to control breathing can have such a wonderful effect on pain relief, all of that. So I teach them box breathing. You can do it throughout the day. 4-second inhale, hold 4 seconds, 4-second exhale, hold 4 seconds. So you think about like breathing in a box, 4, 4, 4, 4. That's something super easy you can do throughout the day. If I'm feeling stressed at work, I will do this frequently, and it helps just kind of calm things down. Another thing, seeking counseling services if you feel like these are things that you're not able to manage. Very important even from a PT standpoint. A lot of the people who come to see me, we kind of joke that most of our job is therapy, less physical therapy. So being able to recognize like what can we handle on our own, what do we need to do with some help, because there are people that are there to help us. Okay, so what happens if you already do get injured? So don't worry, there's things we can do. Depending on the severity of the injury, if it's more of a urgent or emergent situation, definitely go get help. If you tweak your back, something like that, if you have wrist pain because you've been moving things for a long time, chances are, depending on what it is, it's probably going to go away over time. If things don't go away over weeks or months, then yeah, definitely this is something that you should go find a PT, see your PCP about. It's very dependent on injury. Overall, especially for back pain, they do so many research studies on back pain and getting x-rays, MRIs, things like that. Most of the time, imaging isn't necessary, and your pain will probably go away on its own over time with exercise and all of that. One thing you can do, so in the past, everyone would say RICE, which is rest, ice, compression, elevation. They came up with a new mnemonic more recently. It's called Peace and Love. That's more, I think, more helpful and more scientifically based. So protection, avoid activities, especially initially on, that are going to increase pain. Elevation, keeping your limb elevated or your injured extremity elevated can help with swelling. This actually says avoid anti-inflammatories. Our body has a natural way of healing, and sometimes anti-inflammatories can just mask that and interrupt that. So they say avoid those. Compression can be helpful for swelling. Education that overall things are likely to improve with time, and yeah, letting the body kind of do what it needs to do. And then and love, which is load, gradually returning to your activity. Optimism, a lot of injury recovery, so much of what plays into that is based on psychosocial factors. So if you believe you're going to get better, you probably will. These are like very studied things. So a lot of what we do as a PT, yes, I make people exercise, but a lot of it is education on kind of doing things that you want to be doing. We don't want to just avoid movements forever. So having that positive outlook like really does transfer over to physical pain. Vascularization, so making sure we're doing cardio if we can, obviously not to increase any pain, but cardio, exercise, all of that is very important. And then a little review, so modifiable factors, lifestyle changes, psychosocial factors, access to resources, having positive expectations of recovery, and then getting early intervention within the first 6 weeks of injury can be helpful for return to work and can kind of speed up that process. How do you find a PT? So there are a few different ways. Like with anything, I always just turn to Google and find people that way. But our APTA main PT board has this on their website where you can search in people's names based on zip code, location. And then there's Find a Fellow, which is kind of one of the highest tiers of PTs, they've gone through a lot of extensive medical training. So they've done a fellowship, they've done a residency. So this can be helpful for finding people in your area who are highly qualified and know what they're doing. Before we ask questions, I'm going to show you this picture of my cat that I adopted from Barks. His name is Jack. I have never really been an animal person because I think they scare me. And then I just finally got this cute little cat last week, and he's very special. And that's all. What questions do you have? I'm going to stop sharing my screen.
Thank you, Tina.
You're welcome.
Appreciate your picture of Jack. I expected at least 10, so I'm a little disappointed, but you know. We had a couple questions that came into the chat. The first one is, are you aware of, from Chris Smith, are you aware of any literature where pulling forces, sorry, are you aware of any, are you aware of any literature in which pulling forces are associated with dog walking have been measured? So he said it's more for analyzing physical job demand analysis when determining accommodations for gradual return to work.
Specific to dog walking, no. But there are like a lot of, I guess, return to work, more outcome measures. But yeah, again, they're less specific to work. It's more of like pulling, pushing ability, lifting, carrying. Those are the things that are common in our return to work measures that we use.
With those guidelines, people pulling, they could translate to a dog pulling if a person is having that counter force, since there isn't anything specific to dog walking, pulling a string.
Yeah. That
would be good. Close enough. As good questions for this particular audience. When you were having us do the lifting exercise, I had a really great question from a different Christina. And any tips and tricks, like you had mentioned, bending over and making sure the objects stay close to your body. And I think that that's really common when we have wiggly pets. But any other recommendations if we have something that's moving or wiggling or writhing in kind of an abnormal way? Any other tips for that's the object you're lifting?
I would say the main thing is keep it close to your body, as close as you can. The closer it is, like, yes, sometimes you're going to have to lift something and maybe your knees are more straight and you're not in the optimal position. But the closer it is to your body, the more you're using your core, your trunk versus just shoulders, elbows, wrists. So I would say overall, that's probably the main thing. But yeah, it's going to be hard if you're trying to pick up a wiggly animal.
50-pound, Labrador puppy.
Yeah.
One of the things too that I know we try, and not just for the person, but like the safety of the animal and their sense of security, is remembering different ways to pick them up. So like instead of picking up just a scoop, like an arm in front of their legs and an arm under their butt, that's certainly one way that's comfortable, but also avoiding any pressure on their belly, like scooping them under in between their legs doesn't work really well and doesn't give you a lot of control over the flailing legs.
Yeah.
And then another way is placing your hand and arm under their chest in between their legs to kind of create a super supportive environment. And you can do the same thing. You can put your arm between their legs in the back and you're supporting the pelvis and the chest and not putting any pressure on the body. So those are tips and tricks from our side to keep the animal more calm that might help with some of those wiggling.
Yeah, cool.
Another question that's kind of related to that is any tips for walking really strong dogs on leash in terms of protecting your body? And then Victoria asked a kind of related questions, do leashes that connect around the waist, leaving your hands free, is that better or does that work well for avoiding arm strain?
I would say for the first question, if you have a dog that's pulling hard, same thing. We don't want it, the farther things are away from our body, the more strain we're putting on other joints. So if a dog's pulling and you're just kind of letting your shoulder free fly, it's not going to feel comfortable on the shoulder. So keeping things as close as you can, Maybe I like to tell people set your shoulders. So kind of engage your shoulders, keep them close, pull your elbow in. Again, that's just going to force you to use trunk muscles, which is going to be better in the long run. For a leash that goes around the waist, I think it depends on the person because that, yes, while it would leave your hands free, that also is gonna put more strain on probably knees or ankles. So depending on kind of how strong other joints are. If that's pulling you one way, then maybe you're having a like twisting motion on the knees, which also isn't going to be good. So I think overall focusing more on how do I control my body, keep things close. I think that's more important. But yes, if you're not holding it with your arms, yeah, it's going to be less strain specifically on the shoulders. And if you have a shoulder injury, then yeah, that's probably a good other way to do it.
Welcome to the world of medicine in any kind of realm. There's no straight answer. Most of it.
Yes.
We have a really, really challenging in a great way. Question from Nadia is, what thoughts might you have from the PT lens about partnering with animal welfare organizations for like an ongoing support or an established relationship to coming in and training staff or training for protocols of how to do any techniques to prevent injury? Any ideas about that kind of partnership, what that might look like, or how that might get started?
No, I think that's a great question because I think with any sort of career that you have where you're putting your body in different positions, like it's important to be able to know what are ways that we can improve ergonomics, all of that. I think for me specifically, because I've been a travel PT for so long, I move around a lot. So I have, even myself, I have less of like a connection to specific organizations or things where I work. Like I'm an independent contractor, so it's harder for me to establish things like that. But I think that would be totally doable in, I mean, depending on where you live, like how many physical therapy organizations you have. But yeah, I think like reaching out to someone in a PT practice, I think that's totally doable and a good idea for sure. Yeah, I think I can less answer that question just because I move around so much and I don't really have a home PT practice, more or less.
And I believe in Baltimore, there's a plethora of PT options. So I'm sure a
Yes.
place like this, it's definitely easier. I have two quick questions, hopefully. What is a palmar grip?
Palmer, so like front of the hands, palm, grip, yeah.
Okay.
Versus like, this kind of thing, fingers, or yeah.
And then if we should not take anti-inflammatories, what do we take for pain?
That is a great question. PTs are not allowed to prescribe medicine. But I think me specifically, I'm much more of a less is more. Pain is very complex. It's very subjective, depending on, it changes person to person. I am more of a, how can we move through some of this? Like, yes, we need to protect in the early phases. But I like to just slowly, gradually add movement in and like, yes, know that there's going to be some pain initially. But pain is our body's response or our body's way of telling us that like something's going on. And some of that is just, it's going to be there. And then over time, like a lot of education on that. Again, this is not a straightforward answer, but I am always a less medication, more movement sort of person.
Thank you. And it's time to wrap up. So Tina, I want to thank you again so much for being here and sharing your wisdom with us. And this is such an important topic because a lot of us who are in this field, like Dr. Ray mentioned earlier, we care so much about animals and we a lot of times neglect our own body and our own health. So hopefully this is a good reminder for everybody to take care of your body so that you can take care of more animals. And I hope you all have an amazing day. Thank you. Oh, and also join us in the forum for some follow-up questions. If you have any questions, you can ask it on the forum.
Thanks, everyone. Have a great day.
Thank you.
Thank you so much, Tina.